Welcome to Horizon Medical Education and to this our series on meeting our partners. My name's Dr Minnie LeCamp. I'm one of the medical directors and founders at Horizon. Over the past few years, we've been incredibly fortunate to form some amazing partnerships. And today my guest is a medical doctor, registrar and medical superintendent in charge of Magburaka Government Hospital in Tonkolili, northern Sierra Leone, Dr Yusuf Tejan. Hello, Yusuf, and thank you so much for joining me.
Hello, Minnie. It's my pleasure to join you today on this call.
Thank you.
Welcome.
So we first met, Yusuf, didn't we, back in May of 2022, when you contacted us at Horizon to provide some educational courses for your clinicians in the hospital that you work in.
Yes. So by that time, I had just been asked to manage a district hospital in one of the most remote settings in Sierra Leone. So we had a lot of issues, challenges with human resource, the quality of care, and also the medical ethics, and a whole lot of cross-cutting issues that actually affect people accessing and utilizing services in the remote setting. Mm. So on my assessment, I thought that the community health officers, the CHOs, who makes about 80% of the gatekeepers, that is the first responders in the health system in Sierra Leone, that they needed some support, they needed help, they needed some knowledge and key competencies to provide a high quality care within my hospital and even in Sierra Leone. So I reached out I saw Horizon Medical Education CME online on TB and hypertension, and I went through, and I was totally impressed that, I mean, this could be one of the few areas that which we could explore as a health facility. So I made my personal contact to Nicola, who made a post on Facebook, and I asked whether he could assist my hospital, my CHOs, and my other clinicians to have access to this platform. Yeah. So I pitched out the idea, the quality of care in Sierra Leone, and how the community health officers who are in dire need of this knowledge who use this one to make impact in the facilities or in my hospital. So that is how I met. Yes, I met you. I met you all. Yeah. And it has been interesting, and the results have been fantastic.
Yeah. So first of all, Yusuf, I'd like to just talk a bit about you, actually. Is that okay?
Yeah.
I mean, you're such an inspiration, and you're an amazing advocate for healthcare in Sierra Leone. All the things you've done. I'd love to know, and people that will listen to this will love to know a little bit more about you and how you became a doctor. And was healthcare always an ambition of yours?
Innately, I'll say healthcare had been an ambition for me. Mind you, when at the end of the Civil War in 2002 in Sierra Leone, I was 12 years old when I was taken to assist my elder sister in doing petty trading in Bo, the southern Sierra Leone. Mm-hmm. So I started my schooling that year, and in high school, I got a fantastic result, and I was able to get scholarship to enroll into medical school. Mm. So medical school was a calling for me, because by the time I completed my high school, I didn't have a scholarship to enroll into any tertiary institution in Sierra Leone because of my financial background. Uh-huh. My parents, we are all farmers, and my sister was just a petty trader. She was just making a subsistence business, just to live and survive in at the end of the Civil War. Mm-hmm. So it was really, really difficult to have support. But we have an organization they call the Helping Children Worldwide, which is a US charity organization that actually sponsored me throughout medical school. After a proposal was sent to them about my result, because I got the best result in the sub-region in 2008. So I didn't have any sponsorship. So they accepted the proposal to support me through medical school. But despite entering medical school, I learned that I never had in mind that after high school, I'll enter medical school. I was just a kid who was trying to build himself, being the fourth generation to achieve secondary education or even tertiary education in your family. It's something that is really amazing. But no one actually cares in your family because they are not from, they do not have education, they don't know the value of education. So it was extremely difficult for me. So the sponsorship I got was inadequate because I was not able to get my medical materials. I was not able to get adequate transportation and even lunch, even accommodation. So it was really, really difficult. And I was the only one in Freetown by then. All my parents were in the villages.
So
and my
the
sister
medical school was in Freetown in Sierra Leone, was it?
Yes, the one and only medical school we have right now is in Freetown, Sierra Leone. So anyone that wants to become a medical doctor has to go to Freetown to do the program. So it was challenging. At some point in the medical school, I wanted to drop off. I wanted to leave medical school because it was so agonizing. It was so tough, and I had so many reflections. You know, myself, my family, and my struggle throughout the 11-year civil war. And I went to medical school again. You know, to even survive was really tough. But I got personal inspiration from people who believed in me, people who I've been in contact with all the time, and some of my sponsors. So, so in 2014, when we had the Ebola outbreak, and I went to volunteer as one of the disease surveillance officers.
That must have been quite frightening.
Yeah, it was frightening, but you know, sometimes when you have these issues, you as a person, as an individual, you take it as an opportunity to survive. So while other people were running away from Ebola, some of us, we are moving forward to the front line because I needed the support. Because by then I had to write my thesis, I had to do my research, I had to do my electives in the rural areas, and I didn't have any sponsorship. So I used that one, since they were giving like $80 per month to all disease surveillance officers. So I work with MSF Switzerland in Freetown. I work in community with WHO, CDC, and some other staff. I work with one consultant, Dr. Alexander Calmi in Australia. He's still a friend of mine. We used to communicate on social media. But that was how I survived through medical school. And in 2015, I graduated as a medical doctor. I did my intern. And but hence since, when I take any role, when I work anywhere, I take a deep reflection on my life as a survivor of the Civil War, as someone who had no support throughout high school, someone who barely entered a tertiary institution to do a medical program.
Yeah, amazing.
A medical program. And I say it was just a calling because I never knew I would become a medical doctor. So I've always reflected on this, and I have let this serve as a self-inspiration and to also help more people, not only to achieve what their dreams, but to also provide a high quality of service wherever they are, in all positions they are. So that is just me.
I mean, it's amazing to become a doctor. It's so hard. Living was so hard, let alone doing the medical, you know, all the academic work, which is immense, isn't it? I mean, there's a lot to learn.
A lot.
So you're very active with initiatives within healthcare within Sierra Leone, aren't you? And can you explain to us a little bit about the structure of healthcare in Sierra Leone? Because for example, in the UK, we don't have the same cadre of professionals as the community health officers. And you said, they provide about 80% of the primary care in Sierra Leone. They're the gatekeepers, the first port of call. Would that be right?
Yes. Thank you very much. So the Sierra Leone health system, just like other low and income countries, is really challenged with a lot of issues. So one of the key issues had been human resource for health. So we have this cadre of community health officers. They are like physician assistants, actually. Yeah. So they do a 3 to 4 years program in a university, one of the oldest universities in Sierra Leone, the Jala University. And the community health program is one of the oldest health institutions in Sierra Leone. Okay, they started way back, in the southern Sierra Leone, and they've been producing a huge lot of community health workers. So the challenge in the Sierra Leone health system is they are not often able to absorb, to employ all of them. They are not often able to provide adequate training to all of them, even after graduations. But their program is very interesting. I've supervised and monitor most of them. in my facility and other places, I've worked with them. Their program is very rich, but after graduation, they actually do not have any opportunity to any other learning materials or other platforms. Okay.
And yet they're expected to see everybody and make decisions at the first port of call. So you need quite a breadth of knowledge for that, don't you?
Exactly. So now the issue I identify about the community health workers before I brought this initiative is that it is not the absence of opportunity. It is the lack of access to opportunities like online educations. But some of them, when you teach, because I started teaching some of them when I took over the hospital, but it was difficult for only me to be doing that. And we have a whole lot of them across the country. We have over 10,000 community health officers.
Gosh.
who most of them are unemployed, and they had all primary health care units in the district, in the most remote areas. Mind you, we have the secondary health care is actually the hospitals. The doctors are only at the hospitals.
Yeah.
And we have the tertiary hospital, which is mostly in the regional district and in Freetown. Right. So, but the rest of the primary health care facility, which actually is accessible to over 70% of Sierra Leoneans, is managed by the community health officer, the physician assistant. Okay. Yeah. So I think that building the capacity of these, huge number of healthcare workers who add quality to the health system and even support the universal health coverage, which the Ministry of Health and Sanitation is promoting currently.
Yeah.
Okay. And the maternal death, the under 5 death, and some other key health indicators in Sierra Leone is being driven from the primary health care, with respect to what? Early identification, early referral, okay, exactly. and ethical, behavior of healthcare workers, in respect to what? Attending to pregnant women and even people with non-communicable conditions, okay? Yeah. So this is the kind of healthcare system we have in Sierra Leone.
Yeah. And you talked about them not receiving sort of more education or training once they qualified, but you very much trying to change that. You've done some training yourself. Now, obviously, e-learning that we produce at Horizon, there are certain things that you need to be able to access it. You need to be able to access the internet. You need to have something to access it on, like a laptop or smartphone, and you need data. But how do you feel that the e-learning was received amongst the community health officers? Do you think they found it useful? Do you think they found it easy?
Yeah, well, we had our strength in Sierra Leone of recent that most people now have smartphones. Okay, a huge number, more than 80% of people have smartphones. Then that's the internet access. Yeah, the internet access has improved dramatically over the past 4 to 5 years. Okay, so we have more mobile companies who provide internet access in many other places. Okay, the cost to access internet, yes, is still there. Yeah. But these people are put in position actually to be able to have, some amount of funds to save, help them, to access these internet services. Yeah. So it has been challenging for some in remote setting where maybe we have some areas that are in hard to reach areas. So hard to reach areas, and it's actually very difficult to even reach alone on foot or maybe to access internet services. Yeah. But the other positive aspect of this online education was that the creation of awareness among all healthcare workers, among 80% of people who serve the most deprived population, about the availability, okay, and accessibility of what online platform is actually very huge. Okay. Yeah. When we roll out this whole program, it was very small. It was just a pilot at my hospital. Yes. But at the end of the day, when I attend national meetings, conferences, I meet with CHOs and other people who see my name on this platform, and I receive a very positive feedback. I receive the satisfaction, the anxiousness they have, and the appreciation they have with this platform available now at their disposal. Some of them never knew that they could get a certificate or they could get an in-depth knowledge about conditions like hypertension, diabetes, just online. And the different other, find details about how to manage patients who present at your facility with certain conditions.
Yeah.
They never knew. They only thought that they could only learn this through medical school or through go to get a very big book from somewhere else and sit down and read, not knowing that you can read you can do some of these programs real time and apply them directly in your facility to your service users.
Yeah.
So the overall outcome was really fantastic.
Yeah. I mean, one good thing about it is that you can roll out a standardized information, so everybody receives the same level and the same quality of information. I mean, obviously everyone learns in a different way, but it's fantastic that it's a new way, you know, like you said, sort of open people's eyes to a new way of learning. Do you think that the technology will help bridge the gap, that sort of the lack of education or training, continuous training?
Yes, technology will help a lot. In fact, I will say Sierra Leone is behind with technology, application of technology in education. With the emergence of COVID-19, we are able to know that you can do a whole master's program online. You can have Zoom meetings. You can have a lot of things online. So now, initially, people will participate in learning programs, face-to-face only. Okay.
Yeah.
And they have to be there. They have to be there. So except other disciplines, we are in that you need a practical experience. Well, now most of the discipline could be divided into two. You have the virtual experience and the knowledge and other competencies. Then you have the experience and the exposure, which has to be face to face. I think this is a platform. Even our medical school, our universities, other universities are now using this virtual platform to start, teaching, lecturing students, and then later on for the practical skills, they will have to go face to face. So this one will save time, this one will save money, and this one will increase the number of output and also the quality, and it will also introduce people to technology. So I believe this technology is the next. Now we're having what we call online consultations, audio, visual, and video consultations, and you are able to see, signs or classical issues on patients, and you're able to consult and advise patients on this. So I think technology is the next way out for Sierra Leone.
Yeah. And I do think it's not, you can't have it in isolation. I think it's definitely part of the sort of blend of education. Like you say, you can't get all your experience, but you can get an awful lot from the online learning, and keeping your skills up, certainly your knowledge up to date. It's a really useful tool.
Yeah, it is really.
Yeah. So just a little bit about the courses that we did with you from Horizon. You've had a look at the outcomes. What do you feel about that? Was the information helpful?
Yeah, thank you very much. The information, the courses we did a whole lot of courses, from communicable and non-communicable diseases, infectious diseases. Most of the students, in fact, most of the teachers who we are participating in these courses, we are sending to me their certificate of completion, and we are giving their feedback in social media platforms, and they were expressing, how the course had improved, their way of practice and the quality they are providing right now in their respective settings. So when I saw the outcome, the course report, I was not surprised. Definitely, I was not surprised. The improvement, the improvements, and most of those comments, the feedback they were giving to me because these are my colleagues. We meet almost every day, and we meet in conferences, and they tell me how these courses have helped them. I believe the courses we are very, very relevant, instrumental, and needed. In Sierra Leone.
Yeah. Well, we do look forward to carrying on, putting more courses on for you and working with you. And, there is the opportunity for us to, if you have time or whether your colleagues want to help produce some of the courses for Sierra Leone, if that's something going forward, you or your colleagues would like to contribute to the content and to make sure that it stays relevant for Sierra Leoneans. that would be an amazing thing for us to be able to do.
Yeah, I'm sure we will give our support and also our feedback, and we'll always engage and see that we keep on improving. So now that the cause is, almost a lot of CHOs across the country, we even have other cadres. Doctors have shown interest. I have some colleague doctors in the police department. Yeah, so one of them called me, and he had read the Horizon Medical Education programs and the courses, and he has had feedback from his CHOs, okay, in the police hospital, and he was saying that he wants to join and maybe, roll out this course to more other staff in his facility, and he has seen the impact the course has created. These are some of the areas for recommendation, because we have other cadres like the nurses, the doctors, even us doctors, okay, who work in remote settings, who have interest in specific causes as well. So especially the nurses, I will talk more about the nurses. The nurses, they really need a lot of support, especially the midwives. We know Sierra Leone has one of the worst maternal and child health indicators, and we are working very hard through the ministry and other partners to reduce these indicators. Okay, we can only reduce these indicators through individual commitment wherever we are, whatever we are doing, and I believe Horizon Medical Education or online courses is one of the few areas we can improve on ourselves so that we can provide the quality of care our patients deserve in all settings. So we'll give our recommendations, definitely.
Well, that has been fantastic. I could carry on talking to you all day, but I know you're busy.
Thank you for your time.
And we really look forward to continuing to work with you in Sierra Leone, and I'd love to chat to you again soon.
All right, thank you very much. Thank you very much, Minnie. I'm glad to see you today.